in the chat. Build and P5 fiscal strategies. Oh, can we go ahead and I'll pause just for a second.
Danielle, you know what? The poll is not actually working. So instead of trying to figure out why it's not working,
let's just put it in the chat.
Yeah, put it in the chat. Yes.
Let us know who's here. What role do you serve in? Do you serve as an educator and provider? And we realize that many of you may wear multiple hats, so please feel free as well to indicate that. Are you part of a support organization that either provides coaching or TA, a system administrator, an advocate, or something else altogether?
Let's give everybody a couple
minutes
to say hello.
I'd love to see from New Jersey to San Francisco today. We've got a good representative of the entire country. We see some familiar faces out there and some new ones. Fantastic. It looks like we have quite the mix today. It should lead us to a really robust conversation. All right. Well, as a foundation for the conversation we're going to have, we wanted to touch base and share with you the core beliefs that both the Build Initiative and P5 Fiscal Strategies organize all of our home-based childcare efforts around. And these themselves were created to make sure that we're embedding equity into all approaches that we take to supporting home-based childcare. First, we will use the term home-based childcare is an umbrella term for family, friend, and neighbor, family childcare, and all other forms of care that are provided in a home, and believe that they're a crucial and critical part to the early care and education system. Secondly, that all strategies and systems components for home-based childcare should be resourced on par with center and school-based settings. And third, that strategies for supporting home-based childcare educators should be intentional and responsive to the needs of this special form of care and the educators. That home-based childcare must be approached in a systemic and inclusive way across all funding opportunities in a way which supports best practices. So today's conversation is really going to focus in on core belief 2 and 4, as well as highlight why and how cost modeling, when done well, can be a really powerful tool for equity. So with that, I am pleased to turn the conversation over to Gina Capito.
Everyone, thanks, Danielle. I am putting on a slightly different hat today. As you all know from over a year's worth of family childcare webinars on many different topics and really building out those concepts of those core beliefs in systems practice, that Danielle Fuentes-Johnson and I partner on behalf of the Build Initiative's work. I also do work related to fiscal strategies. And so today I'm joining you as a principal and founder of Prenatal to 5 Fiscal Strategies, along with my colleague Simon Workman, in order to use this platform to do really deep discussion on cost modeling and what it can and should mean for home-based family childcare providers to really think about this particular audience. And so I'm just going to pause and let Simon say hello as well.
Hey everyone, Simon Workman with P5 Fiscal Strategies. Good to see some familiar names and lots of new names as well. Looking forward to talking about this topic today.
So please do feel, we always try and have these be as interactive as possible. So there's a fair amount of content to cover when we talk about cost modeling, but we want to encourage you to use the chat to put questions. Simon and I will go across our turns sharing with you to have you and answer questions. So don't hesitate to put things in the chat at any time. Don't feel like you need to wait until the end of our presentation for questions. I also would like to take a moment and introduce Lana Dumas, who supports and works closely with Danielle and I in all of our home-based childcare work. And in particular, as a former family childcare owner and a leader in family childcare on the national scene, is going to share a little bit about her perspective on some of the elements of price and cost and understanding cost modeling. So Lana, if you have a quick moment to say hello as well.
Hi, I thank you, Gina and Simon, for letting me chime in on this session. This is near and dear to my heart because it's so important to actually equity and valuing the home-based early learning setting on par with the other early learning settings. So it's going to be a great ride today.
Thanks, Leanne. Let's tell you a little bit more about Prenatal to 5 fiscal strategies in case you're new to hearing about this organization. Simon and I lead this national organization, and one of the reasons that we created it was in order to take our opportunities where we had worked in local areas or even at the state level on very project-based approaches to understanding cost and really take that and have it become more of a field movement. We knew as we had these opportunities in local places that while those were great for those local communities, the type of deep systems change and the broken fiscal and governance structures that exist within the Prenatal to 5 space was not going to be addressed by one small project at a time, that we really needed a field-facing and field building initiative that was focusing on this. And part of that is, as we've conceptualized it and built it across many of you supporting us in this work and thinking about what this work means on the ground, as well as other leaders in the fiscal and governance space, is that we really think about this concept of a shared set of principles, that we're not trying to solve one problem at a time, but we're really thinking about the whole that we're trying to focus on and solve, and that we have guiding principles that drive that, and that we are then also not just tinkering at the edges, as oftentimes we hear folks use the phrase, that we really think about that fundamentally we need to shift something. It's not as easy just to say we need more money into our childcare system or we need more money into our early care and education system. We also need to think about how we administer that money and how we break the historic inequities that come with how that money has been administered in the past. So it's not just enough to handle one problem, but we need to be thinking more comprehensively. And so that's one of the reasons why we felt the concept of a field-facing or field-building initiative focused on the Prenatal to 5 space around fiscal strategies was such a critical need at this point in time. And so that brings us to you today with this webinar, which is really not really a part 2, but sort of a deeper dive specific to home-based childcare. But we wanted to highlight that you may have been part of our webinar on February 15th, where we were going through this concept of using cost estimation to inform childcare policy. And so we were talking about cost modeling, answering some basic questions about it, but also really talking about the ideas around what cost modeling and cost estimation can do to support good childcare policies and good childcare policy decision-making. What we've found in doing this work across the country is that there are lots of questions about it. At times there may even be concerns and tensions around whether or not will it be a positive thing. Kind of any change can be perceived at times as negative, even if it's change in a more equitable, more positive direction, more income coming with the change. We still know what we have currently and we know the system that we're in. So we know that the opportunity is to then go deeper with audiences to discuss what this can mean for you. And that's why family childcare or home-based childcare settings was such an important one for us to bring this topic to and dig deeper in particular on what cost estimation modeling means to family childcare. And so there's no end to the amount of interest in this topic for sure. We had nearly 500 registrants for today, and we had over 500 registrants for February 15th. So either everybody is sort of as into Excel workbooks as Simon and I are, or you all see how important it is that we do something about how broken how we finance childcare is. And so we're thrilled to have this sort of army of leaders alongside us in this effort. And we'll throw the link to the report in the chat just in case you want. And of course, Simon already did it. You can tell we work together a lot, just in case you wanted to go out and grab the report or you hadn't seen it yet. So that's the snapshot that you see there on the thumbnail on the screen, is that particular report file that's in the chat. So let's dig in a little bit more on sort of the foundation of what we're here for together. This, I would imagine that some of the content we're going to cover right now is stuff that you know well. And if you don't know it well, in the sense of some of the terms I'm going to use, you live it every day as a childcare provider, as an individual who is part of this support system, who is trying to work with family childcare homes. And so this is not new information, and we acknowledge that. But I do think it's really important that together we set the stage and that we operate from a shared platform of understanding on what the sort of problem that we're going at and trying to address, and how it manifests itself. And so that's where we're going to start. We're going to start with talking about the childcare market and why and how the childcare market is broken, sort of how we got to this place as a system within our states. And so what I want to be clear about is the concept of a market in and of itself is not broken. So if you or I went out to buy a cup of coffee at Starbucks and that cup of coffee cost us $4, and we are willing to pay that $4 compared to maybe the 50 cents we can make that coffee at home, we are part of that market. Starbucks can charge us $4 because we pay for the $4, right? So the concept of having a market is not what we're talking about that is broken. But childcare and the nature of how the childcare market works, and when we talk about the multiple sides and how the interplay of them, we start to see how the foundation that we're functioning upon does have broken pieces to it that then are cyclical and how they sort of inform each other and continue to reinforce that sort of brokenness, for lack of a better term. And so when we think about that cup of coffee that I'm willing to spend $4 for, we have to think about the alternative here in childcare is those are families. Families are the consumers that are going out and purchasing childcare. Families, especially families of very young children, and oftentimes the families are younger themselves, are very price sensitive consumers. For the most part, and especially families that are qualifying for state subsidized or federally subsidized childcare, cannot purchase the cost of childcare in full. And what we know from years of doing this work and data on cost is that they really can't purchase high quality early care and education in full. And so this then lowers the demand that's available for quality, because the reality is where I could drive on past Starbucks and not buy that cup of coffee if I don't want to spend $4. If I'm a working family, I have to purchase childcare. I need somewhere that my child can go so that I can go to work, right? So we have to acknowledge that then we're going to be put in a position as a family of making decisions around that purchase that maybe aren't informed by quality. They're maybe informed by more of what I can actually afford. And when we think about the percentage of an income that someone's income that they can put towards childcare, especially a low income family, it is nowhere near what the actual cost of that service is. This puts providers in a position of price competition. As a provider, and family childcare providers are such a great example of businesses that have been built in communities to serve those communities and the families that are in your own neighborhood, that you have to then think about, what can I charge them that they can actually pay? So right there, your tuition is not based on what it necessarily costs you to deliver the service or all in your budget to run a family childcare home, but it's based on what the community can afford, what the families that you're trying to serve with your business are actually be able to afford. You also have an acknowledgement of the fact that there's other providers in the community and they have a price point that they're charging families tuition at, right? And so you sort of are thinking about these things, which are not necessarily related at all to what the cost of the service is or what the cost of quality is. So there's an element of discouraging providers from investing more in quality, because if families can't pay for it, you're just making the gap between the tuition that you can get from families and the cost of delivering the service greater at greater levels of quality, higher levels of quality. The other flip then of how this really continues to cement the brokenness of this approach is how we currently, in most states, except for one in the District of Columbia, set those subsidy rates. So using the federally available funding source, the Child Care and Development Fund dollars for subsidy, which every state, tribe, as well as territories have access to and use, the approach is using market rates, and market rates are what tuition is charged to families. It's what a provider tells us is the amount that they charge a family in their community to come utilize their family childcare home. By the nature of using a market rate survey or going out and asking family childcares as well as centers, what do you charge for your service? And then having that information become the market rate survey, we're embedding that failure in the system, that families can't purchase what the cost of care is, yet the subsidy rate that a provider can access to receive revenue to support them in delivering their care to children and families is based on that tuition that they believe they're able to charge families. It's not based on what the cost of their service is or what the cost would be for them to deliver the type of quality that they're striving for. It's also further broken by, and I'm sure you all can imagine this without even having to have it spelled out, but that low income areas, tuition rates are lower Therefore, the information in statewide market rates surveys for low-income areas shows lower tuitions, which then we have a cycle, because that then feeds into the subsidy rate, and the subsidy rate that's paid to low-income areas is lower than what you may find in higher income areas. So right there, we have the continued kind of disincentivizing of quality, but also the ability of the voucher in lower income areas to actually purchase what high quality costs that's even further away from that reality in lower income areas. But again, because of tuition, not because of the actual cost of care as the driver. So that's where our broken element comes from, is what is the driver of this? And as I mentioned, there's one state, and that's state of New Mexico as of July of 2021, and the District of Columbia as of 2016, have used not market rates to set their approach. So we're going to talk a little bit more about what that means if you're not using the market rate, and that takes us to more this concept of cost modeling. And so before we get into cost modeling in more detail, just want to talk a little bit about this idea of that impact on equity. And it sort of relates to some of the very things that we were just talking about. And in some of the data collection, particularly with family childcare providers, we find providers, when we're trying to engage in more of this cost of care or true cost of care, not just the care you can pay for now based on the subsidy rates you get now that are based on the market rate, but more based on what you would pay an assistant. What would you need to pay in order for someone to not just come and work for you, but stay with you for the long term, and instead of having to move on to a position that pays them at a higher rate, but maybe is outside of childcare. That gets more to that concept of the true cost of care. What we find is that we really have to dig in and understand that we have to have conversations on how you run your program and what you would want to do in order to avoid this bifurcated system where what you're currently paying is driven by being in a lower income neighborhood compared to a higher income neighborhood. And it's all then goes back to this idea of what families can afford to pay versus what the actual cost of the service is that's being delivered to those children and families. And we know that this has a couple of ramifications as far as things that we need to think about. Obviously, I talked about the fact that it has a direct impact on the subsidy rates, but we know that it also then doesn't support the capacity of the providers. It doesn't incentivize providers to invest in long-term quality enhancements to their program if they're already seeing a shortfall. And so we really need to then think about whether or not this is supporting families in the most low-income communities to purchase high-quality care. And what we're finding through doing these types of studies is that the subsidy is not supporting families for that sort of purchasing of the highest quality care. So let's talk more about where we're headed as a solution and the idea of cost modeling. And Simon's going to talk to us a little bit more about this.
Thanks, Gina. Hi, everyone. So yeah, let's talk a bit about what you do about this. So Gina did a good job of laying out, why the market is broken, and particularly what that has an impact on equity, and particularly, when you start thinking about all of those things that come out are even worse for home-based childcare settings, essentially. And so, this idea of cost estimation modeling is a process that will really help to address a lot of those issues with the market, and moving away from this market-based system and more to a cost-based way of thinking about the true cost, about setting rates, about understanding the actual cost of any kind of new initiative or any policy initiative that impacts home-based childcare providers. So essentially what we're talking about is this desire to build a cost estimation model. And so what is that? Well, it goes by lots of different names, right? You might have heard it called a fiscal model, a cost of quality model, a cost of care model. We are using the term and trying to sort of more standardize the term of cost estimation model, because honestly, that is the term that the Federal Office of Childcare uses. And, as the federal government looks to sort of require states to actually move to setting rates based on cost, which is an option at the moment. Under the Build Back Better proposals, it would be required after a certain number of years. And while obviously that proposal is up in the air, I think if we see a sort of childcare proposal from this administration as a kind of slimmed down version of Build Back Better, this is likely to still be in there. So what is a cost estimation model? Well, essentially, it's a tool. And when we say a tool, when we say a model, we are often talking about literally an Excel-based spreadsheet, an actual tool. There are online tools available. There's the provider cost of quality calculator, which is offered by the Office of Childcare. There's a few other online calculators that are available. But essentially, you know, when we are doing it for rate setting, we generally end up building a sort of customized Excel model based on the provider cost of quality calculator, you know, so that it is aligned with the federal requirements for modeling. And essentially, you have a model then that can estimate what is the cost of providing care at different levels of quality, and what are the resources providers need in order to remain solvent. And you know what's really important about this is there are varying levels of quality, and you know a good cost estimation model will allow you to account for all the different definitions of quality that exist. If you have a very strong quality rating improvement system in your state with most providers in it, then maybe you will use the QRS levels. But if your QRS is not very robust, or is going through a revision, or is not widely understood as a measure of quality in your state, you can set any number of quality levels. It's all about what are the variables that are in the tool, and we'll talk about that in a little more later, and being able to sort of model out along those steps of those variables. And then on the resource side, you're also thinking about, you know, understanding what are the revenues then you need to cover those costs, and it's to remain financially solvent. And so when we talk about that, it's not just to meet the actual cost. You need revenues to be running a sustainable business, which means we often will build into the model a contribution to a rainy day fund, right, to an operating reserve, to make sure that you actually have money to replace that carpet, to, you know, replace that roof when it starts leaking, when the boiler breaks, right? That there is something in your business in the understanding of the rate. So the idea is of this model is it's not a budgeting tool. You know, while it kind of is tempting to use it for budgeting, and you can think about it, you know, how it can look for your budget. Of course, if you're developing a tool that is meant to be used by a whole state or a whole community, it can never reflect exactly 100%, you know, every single program. And especially that is true for home-based childcare, where there are very different sort of models of ages of children you serve, you know, what your desired enrollment is, etc. You know, what your actual expenses are based on, you know, your home environment, etc. But the model basically takes a lot of data and allows you to sort of understand what are the impacts of all these different variables. What is the impact of program size, of the ages of children served, of what geographic region you are in the state or community, you know, enrollment, how full you are across the year, whether you're collecting all of your revenue, which is the bad debt number there. And it allows you to then sort of see the impact of what happens if you take subsidy, what happens if you take the child and adult care food program, you know, seeing all these different funding sources that you may or may not have access to in your state. Are they enough to cover the actual estimated cost of quality? And are they enough to cover the cost of quality at different levels, say? You know, most states have a tiered reimbursement in their QRAS, but is the estimated additional cost of being at high quality covered by the tiered reimbursement? The idea is the model can illustrate those things. A lot of the data that you know right now, but you don't necessarily have hard numbers to put behind it. And that's what a cost estimation allows you to do, and can be used from everyone from, you know, the policymakers, people actually setting rates, you know, to providers, to even understand, even though it's not a budget tool, but to understand, well, what would it look like if I served one less child or one more child, or, you know, participated in the food program? Or what would it look like from an advocacy point of view if you're advocating for increased investment in this sector? The models can be used for that purpose as well. One of the things I want to be sort of clear on before we go too much further is this sort of reflection of the terms and talking about the difference between price and cost and true cost. And so, you know, these are sort of the terms that get bandied around a lot in this conversation. You often hear the conversation saying the price of childcare is too high, you know, families are paying a lot of money for childcare costs too much. What people are normally talking about when people say, when you see news reports that say childcare costs too much, they're talking about the price. And, you know, I'm always kind of sitting there saying childcare should cost that and should cost even more, you know, which is, you know, hard to say to a parent who is currently spending 20 to 30% of their income on childcare, right? But, you know, the price, as kind of Gina was saying a bit earlier, is really reflecting what the market can bear, what families can actually pay. If you are setting your rates, you look at the market and you say, what can people afford? And that does not necessarily reflect the cost of the expenses of running your program, right? So when we talk about cost, we talk about actually what does it cost to run your program. And this is a place where for the home-based childcare field, it becomes really important to be clear about what goes into each of these buckets. So often the home-based childcare providers do not pay themselves a salary. They do not, set up a budget with an income for themselves. So when they set prices based on, their actual expenses, they're not including a salary from themselves or only a very small amount of salary. They kind of take whatever's left over at the end of the month as their income. If you talk about cost, you actually say, well, what is the cost of that provider's time? What is the cost of the home-based childcare operator, owner operator, that is actually their time? And you build into the model an amount for their time. You actually have a real cost in there. So you're actually comparing, especially if you compare it to a center-based program, you're able to actually compare, in both programs, the people providing the care are actually paid. Then the true cost is where you start saying, well, what should they be paid, right? What is the right way to operate the program? If we go out and talk to providers and ask them to tell us their costs, we can work through that and get to it. But as you all know, most providers right now are operating on a scarcity mindset, have been making do with the low funding that's been in this sector for so long. So, you're making it work without an assistant. You're making it work by having other people in your household help out when you need to, by doing the grocery shopping for the kids at the weekend, right? All of these other things, by being severely underpaid. When we talk about the true cost, we start saying, what would it actually cost to meet these quality standards, to meet these licensing standards, to provide the high quality care how to provide, and say, let's actually account for that. Let's build in whether you need a part-time assistant, even if licensing regulations don't require it. But if you're saying for high quality, that's what's needed, let's build that in there. Let's actually talk about what a salary should be for a family childcare provider that actually reflects the number of hours they work. So this is a really key kind of distinction between price, costs, and true costs across the sector, but even more so, I think, in family childcare providers, where we have for very, very far too long really talked about the price. And sometimes it's, hey, family childcare is a much better option because it's cheaper, it's got a lower price. Well, but then we have to ask, who is picking up? That is on the backs of that low-income family childcare provider who's struggling to pay for their own family and keep their own family fed and sheltered. So, it's really key that we kind of be clear about those definitions. And I'd love, Lynette, if you've got any reflections on this, having run a program and been involved in this sector for a while, I'd love to take a moment to see if you have any reflections.
Yeah, it really is very illuminating to have the different definitions, because I know as an operator, working with operators in the Child Care Resource and Referral, and also as an eligibility examiner with the state, when we're doing this, the market rate survey, what people are giving is what parents can afford or what they think the state will pay. And so when they're answering the market rate, you're not actually getting this cost of care or true cost of care. And so then it's basically garbage in, garbage out. And then the expectation that this is being subsidized by something else. It's being subsidized by public assistance mechanisms or a spouse or other spaces, and we're not actually supporting the fields. And then when you're talking something that Gina mentioned earlier, when she was saying about families actually picking what works for them. I know that families have had to say, well, if I put my child in a child care center, even though a family child care works better for me, if I put my child in a child care center, I'm going to get a higher, I'm going to have a lower copay because they're going to pay them a higher amount. And so then you actually aren't meeting the needs of families, and you're not encouraging quality care. You're perpetuating the idea of low cost care and home-based, even though they're both early learning settings.
Great, thanks, Lynette. So in all our work through this, we have really kind of, we try and make sure these sort of pieces go through all the work, but we've really kind of come down to, what it is that makes a successful model in order to make sure you are getting to the true cost, right? And so, the three things on here, and we'll walk through the process of modeling in just a moment. But before that, just to kind of give you the crib sheet of, cliff notes of what are the main ways to have a successful model. The first one, above all else, intentional, authentic, ongoing stakeholder engagement, right? If you do this without providers, without stakeholders, you're going to come up with a model that does not reflect the true cost, right? It's going to reflect whatever data was out there, and then you get all of the inequities about what data is collected, what data is available right now. You get market rate surveys, right? Market rate surveys are very good at capturing the market, but the market's broken. But the market rate survey is a one and done. You ask the question, the provider sends the answer. When you're doing modeling, what we find is you have to kind of have this back and forth between providers, between the stakeholders and the people who are building the model to be able to say, okay, this is the data we've got, but it's making it look like this. Is that where we want to do this? Or do we want to actually say, no one is even able to kind of think right now about what a model should look like to do properly because you're in a scarcity mindset, right? So we have to kind of have that back and forth that says, well, hey, if the requirements are you do this, 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 and this, let's talk about the time for that. And if that means you need a part-time assistant, we should talk about putting that in the model, right? It's an ongoing process. It's also, an ongoing process to make sure that people understand what goes into the model. Part of the work Gina and I have been doing recently is really socializing and demystifying the idea around cost modeling. But that becomes really, really important when it's about potentially setting the rates for your business, right? That's a huge part of, and especially for home-based childcare, where it's really is like their main source of income in most cases. So making sure that people understand what's going into the process, so whether the numbers come out at the back end, right, they understand kind of all the sort of math and at least the sort of process that went through to get there. Which kind of goes to the second point here, which is the relationship between the model and scenarios. As I mentioned before, we really are talking about building a model. The model kind of gives you the parameters to answer questions. The scenarios are really, how do you answer those questions? So if you say, how much does high quality childcare cost in New York? The answer to that question, there is not one answer, right? I would have to run a model. You take the model, but the scenario is, how many children are you serving? Are you a large family childcare home? Are you a small family childcare home? Do you employ an assistant? Do you offer health insurance? Do all of these different sort of tenets of that get to a scenario? So what we try and work out with the model is that you have a shared agreement around the inputs to the model, but then multiple different people for multiple different purposes can create scenarios to answer the decisions they want. Then you can kind of leave behind all the arguments about, well, should this model have health insurance or not in? It's built into the model, and your scenario can choose whether to turn it on or off, right? So you kind of move to the ability to be really flexible with the model. Which then goes to the third point about, when we see these models, it's not a one and done, right? It's a you can have a model, it's led by the data behind it, but as that data gets updated, as that data changes, you should update the model, right? This talks to very much about salaries. If you're going to set a model and have some salary guidelines in there, in 5 years' time, you should not be using the same salary guidelines, right? If minimum wage is increasing, if kindergarten parity wages are increasing, if inflation is going up, right, the model should reflect that. If quality standards or licensing standards change, the model should reflect that. So it's not a cost study that tells you just at one point in time. It is a flexible, responsive model that can be updated multiple times. So let's talk a little bit more about the process within modeling. And so, we have kind of developed this 4-stage process, which kind of goes through some of these areas I already talked about. Essentially, it's, you've got to engage stakeholders is sort of number one and here across there. You have to collect data from, providers primarily you collect data from, but you also collect data that already exists out in the state, because sometimes we want to go beyond what providers are currently doing. So just asking what providers currently pay in occupancy costs gives you really varied data, right? Because some people own their house, some people are paying a mortgage, some people are renting. You also need to be collecting other sort of extant data to inform the model. You take all that, you develop a model, and then you're running scenarios and reporting results. And so, as we kind of looked at that, we're just going to briefly, and the report goes through a lot of this in more detail, so we won't spend too long on this. But just in terms of that process, there's a couple of slides here to talk through some of that process. firstly, engaging stakeholders. Well, as I said, you've got to engage a lot of stakeholders and engage them where they are. We have been doing this modeling in a few states recently, and if you want to talk to family childcare providers, we have to often do meetings in the evenings or weekends, or make sure they're during nap time, right? We have sat at tables before where, family childcare is invited and they didn't come. And it's like, well, of course they didn't come. It was 10 o'clock in the morning, right? So being really intentional about that stakeholder engagement and meeting providers where they are, going to the associations they're already part of or the groups they're part of. It's really important to make sure that you're being responsive to the feedback. And being aware of language barriers, right? And making sure if we're doing provider surveys that they're available in the languages providers operate in, and also speak to the literacy level of where the providers are, right? That we are not, writing in economic and math jargon that most people don't deal with every day. Just because Gina and I are building the models, we deal with it all the time. Actually being really responsive about saying, let's use the provider voice. And that again comes to the stakeholder engagement. Like if you bring stakeholders along with you, you have trusted people to show the survey to and get their input on. And that goes to, the collecting data. Again, a lot of family childcare providers, don't necessarily have great budgets, and they're great caregivers, but they're not necessarily business people. And so part of this is being really clear about, this is where you'd find that data. It'd be on your Schedule C taxes, or, let us talk this through with you, and really kind of, being responsive to the fact that these are not people who have like financial managers they can just send the survey to or send the data to, right? That you are talking to the person who's doing 75 other things that week. And so being as responsive as we can to stakeholders in the collection of data is really key. So Gina's now going to talk us through like what you do with all that data in terms of developing the model and the kind of underlying pieces of the model. So over to you, Gina.
So here's where we want to unpack a little more of the really what's in it, and following the chat, and I did a little responding to some of the questions in the chat, but then there's also one out there right now about sort of how this process can raise up and compensate providers fairly for the work that they're doing. And that sort of that hits the nail on the head. But what we thought was really useful for today's webinar in really engaging with the family childcare community and all of you as leaders is to walk that through from the perspective of what this looks like for family childcare. As Simon mentioned, this 4-step process, this is available in detail in that report. That's one of the first links in the chat. It doesn't necessarily look different whether you're doing it only for center-based childcare, family childcare, Head Start programs, right there. That's the bones of doing a cost modeling process well, and our best practice experience of doing it. But the what is embedded in that, and what an ultimate model looks like, and how it attributes for what it means to be a family childcare provider, what the operating model is for a family childcare provider, felt like that was some of what we really thought would be the most useful for us to be discussing together in this platform. So we wanted to kind of give you that overarching frame for it. And then we want to unpack more of what this means for family childcare providers, because no matter how much we talk about sort of all expenses, data collection from all providers, we just translated a survey into 7 different languages for a state that we're working with, like we truly mean everybody in the pool kind of approach. Folks still then have questions of, does it mean that it's going to be the salary that I believe I should pay an assistant, or it's a salary I currently pay them? And our answer is actually, we want both in the model, because to Simon's point, we don't want to just understand current costs under the broken system, but we want to understand true costs and where we need to be going. And so, but we really find that it helps if folks can really wrap their hands around it more. So in thinking about developing the model and then this concept of running scenarios, we want to move into talking more about the idea of cost drivers, because ultimately the cost model is made up of a series of cost drivers that stakeholders, family childcare providers, center-based providers, childcare leaders in states and communities inform and build. And it's really important that we pin the current circumstances, but we also have that information about where we're headed, not just minimum wage ordinances, but living wage and full compensation, including benefits, as Simon was mentioning. And it's those sorts of conversations on cost drivers that are of critical importance to make sure the model is built to reflect the community or state or both that is doing the work to pull together this tool, because the tool becomes an ongoing resource to really understand expenses of childcare providers and then accurately make decisions on revenue, especially subsidy revenue, in light of those expenses. So let's talk a little bit about that concept of cost drivers. This again goes to the idea, we mean everything. So starting with personnel, that first column there on the left, we are talking about a model, and I know I did a very lengthy chat post on this question of salary, but we are talking about a model that includes compensating the family childcare provider owner, as well as any other staff that you may have. So if you're a small family childcare home and it's just you and you're the owner as well as the teacher, then there's a salary for you as owner and teacher. If you also have a part-time assistant, that would also go into personnel. In both instances, we build out, and this is where the concept of cost driver really comes into play, we build out all the mandatory benefits that are associated with that concept of employment. So all the like FICA and state unemployment and workers' compensation. We acknowledge that as a business owner, you don't necessarily pay for your own unemployment insurance and you don't pay for your own workers' compensation. You do pay your FICA because you're paying that to somebody when you pay your taxes. But the point in the model is to accurately account for those expenses as part of understanding how much it costs for family childcare to be delivered to children, instead of thinking family childcare is cheaper because it doesn't include these things, which is sort of the historic misinformation that has been fed into this. In the end, there are instances, no doubt, where family childcare does end up costing less than center-based, but it's still based on the actual cost of delivering family childcare, including all of these cost drivers. It doesn't cost less because there was no salary for the owner and there wasn't enough for the assistant reflective of what they needed to cover the care of the children, right? There's a difference in understanding that programming costs different amounts across family childcare and centers, depending on the ages of the children you're serving, depending on the size of the program. There's a lot of different variances. Those are still cost-informed differences versus right now what we have is sort of more of a working knowledge, and what families can pay is telling us what things cost. And as we know, it's not telling us what they cost, it's telling us that price concept. We then also include all of the non-personnel. And as Simon mentioned during the data collection, we try to make this as easy as possible for family childcare providers that whether they do their own taxes or they have someone else support them to do their taxes, we really follow that Schedule C because you're answering all these questions already as part of doing the taxes. And so we can really capture that information. And what we're trying to understand is then also in doing good engagement with family childcare providers, not just what's on paper on their taxes, but again, where it would go. And so an example of this, and we're going to talk about quality in a second, is that family childcare providers reflect to us that they would want more assistant time than maybe what's on paper under the licensing regulations. They'd like to have access to and bring in curriculum supports and like a music teacher, a gross motor support person that can enhance the curriculum they're delivering as part of their early learning experience with the children. Those are things that aren't always in the current dynamic of how a provider is delivering their program, but it's things that they're striving for or they're able to do sometimes. We want to include those in non-personnel because we want to understand that reality of the program that they're seeking to deliver and make it more of the standard operation versus the sometimes I have money and I'm able to bring in a curriculum support person. And it's only through conversations with providers that we can really unpack not just these very sort of concrete programmatic characteristics or cost drivers on this way, but then we can get to more of a conversation about quality variables. And when we go to this next slide to talk about quality, before we start to unpack this, I want to take a pause and say that here we're talking about quality as we think about the quality we deliver to children and families. We are not talking about quality that's defined by a quality rating and improvement system. We're not talking about only quality as defined by a current infrastructure in the state or community that you live and work in. I know that within childcare that we all are very familiar with the systems and how they currently operate. And what I want when we think about this, especially in modeling, is to pause and think about what does quality look like in the services we deliver to children and families, and those things have associated costs. Let's kind of separate that from only thinking about quality as a number on a rating scale or a star level, because oftentimes, and this came up in the chat too, there are reasons that individuals haven't achieved a number on a rating scale or aren't part of that system. And it could be because the system is not designed for them and it's sort of leaving them out, or they don't have the resources, the dollars to do the things to get the rating, to move up the rating scale, right? And that is another huge example of cyclical. So I want, as we talk about this cost drivers from a quality perspective, I want to kind of break us from that. And we use the term quality frame in a very generic way in order to just remind us of what do we know about quality for children and families, and how do we know that providers work really hard to deliver that quality to children and families, and what are the costs associated with that. So it's not only linked to a maybe current definition of quality that's defined by a larger system that maybe isn't as reflective of family childcare. I think that that's a really important piece. And your center-based colleagues would reflect the same thing often on how the quality system feels, that they struggle with really counting the right thing as a function of quality. And so I want to sort of put that out there. And that's actually how, when we do the work on building cost models with places, how they become so tailored is they really think about the future of where you're headed as a system in trying to really reinforce and build quality that gets at the nature of the experience that delivers quality and doesn't just link it to things that are maybe on paper. And so as systems are trying to move to that space and become more equity driven, this sort of experience of really thinking about cost variables within this concept of quality, this real, like, what is quality on the ground with children, can actually be really helpful for state systems and communities to really be thinking about defining some of this for themselves and putting it into the cost model. And so you can see that it includes many things that we've already talked a little bit about, but it includes things like actual compensation. And so not just putting in a salary, but then thinking about what should compensation be. And for the provider owner, is compensation linked to the same level of compensation that you would expect a director of a center would receive, because the owner operator is doing all the same tasks of a director. And we grapple with those very questions in order to ensure that we are accurately thinking about what these things look like in the delivery of the program. And then that's built into the model. So the model has these components into it. We also know that just some of the things that we want to deliver and want to offer for anyone doing work with children and families often have higher price tags the more of it we do, right? So what we refer to as non-contact hour or release time, however you sort of want to think about. Nobody likes release time. Release time sounds like we're talking about something else, right? Then this is what we're talking about here, is the idea of planning, that we all need time in the work that we do, and particularly when we do work with children and families, to really intentionally think about that work, to plan for the engagement with the children and the curriculum that we're using to support their development, to foster their learning, and to do that outside of instances when we're also trying to rock a baby or support a child going down for nap. That have some dedicated time to do that. The way we build that into the cost model is it translates into assistant hours or substitute or floater time, so that the teacher, the owner, provider can step outside of the role of caregiver for an hour a day or 2 hours a week or whatever kind of level it gets pinned at. And we actually do it at multiple levels, usually within the model, so that they can do that sort of planning and that they can have that sort of dedicated space for that planning. As you have more of that, maybe you have more hours a day. So if you have an hour a day compared to only 2 hours a week, clearly the amount of substitute hours or assistant time is going to go up, which you can see how that becomes a cost driver then. But we also know that more time to be planning can be really good for being really intentional about all the children in your care. What I think I want to move us to now is to take a quick look at what a quality frame looks like in practice. So this is just a snapshot that Simon and I pulled to share with you all to give you a sense of this idea of that there could be multiple points within a model. So you're not making a single decision on what this should look like within how the program functions. You actually have the opportunity to put in multiple points, and generally from sort of left to right, the increasing to higher levels of quality, and then understand the difference in cost. So in this particular example, which we shared 2 snapshots. First is professional development supports or release time, training hours, things that staff need to have additional time to go and do. You see that there are some hours required under licensing. So those are here because we always want cost models in any state or community to meet licensing. We also want them to go far above and beyond licensing, but we want to understand the cost of going beyond licensing, right? So that's what we're trying to do with this sort of a frame, or what's included in the model under a quality frame. And you see that the number of hours required under licensing for centers and family childcare is different. And that's a licensing point. In this particular experience, in this state that we were working with, they made some decisions just to keep things the same for a couple more levels of quality points. But then at the highest level of quality for professional development hours, they said that all staff, whether you're in a center in a home, the cost model should include the costs associated with the same number of hours. So the teacher in a family childcare should have access to 40 hours of professional development. The owner should have access to 40 hours of professional development, and the costs associated with securing access to those 40 hours should be included in the cost model. That's really what they're saying with that all the way to the right, to that decision point. And you see the same concept of those non-contact hours, or the release time here is the next variable. And it talks about that 4 hours per day of non-contact hours per home is what's included in this particular model at that highest quality point that they're able to select from. There's also a coach built into the model as well, and the coach is for family childcare too. So we walked through this concept of what are professional development supports, and how do you go from the base requirements of professional development supports and move up to higher levels of professional development supports, and what are the associated expenses with that. You also see on this, and I'm going to move through this quickly because we want to get you to a couple of results, that the curriculum supports I just mentioned as an example were something else that was mapped, not required at licensing, but at higher quality levels. We know that having access to additional curriculum implementation supports is good for both family childcare and center-based programs. And so that was built into this particular cost model frame, and allows anybody to understand what those costs are to have the higher curriculum implementation supports at higher levels of quality. So quickly, before we go to looking at a couple of results together, I just want to share this timeline. You have access to the slides, so since we're going through this pretty quickly, just wanted to highlight how deep and long this process is. So all those pieces that Simon just went over, you see how much time is actually spent on the engagement with stakeholders, the data collection process, and there's a lot to be done to really engage providers in the community to feel comfortable with the process and engage in that data collection process. And so it's not expected to be done in a 2-week process. It's really a long-term process of really engaging with providers in this data collection. Let's talk about sort of what do you get out of it? What is at the bottom line? And this is one of the most straightforward ways to think about the output of a cost model. This is from a county level cost model. And the question that we were answering with this slide ran from their cost model was, are the revenues available sufficient for the cost of family childcare? The orange circle is the annual cost per child to serve an infant. And this happened to be at basically kind of the middle point in quality. If we were to take all those different quality variables, the best way to refer to it is kind of midpoint. It's more than licensing. It's not the highest necessarily standards of quality, but it's kind of right in the middle. And in many communities would say, like, we want all families to have access to at least that middle point of quality. And that's, in that community, $30,000 in a family childcare home annually is the cost of that. And what you can see here is the available revenues to cover that a provider can access, tuition being the first one in pink, so the private funding, and then all the other sources being public funding, that the closest we get is 17,000 compared to the 30,000 expense. So this is the kind of most basic output that you can get from a cost model, is this concept of expense compared to available revenues and looking at the gap or disparity.
What tool were you using? What crayon pen?
All right, so let's move quickly then to talking about this idea. And Simon, since we only have a couple minutes, I'm going to turn it to you to talk a little bit about this idea of how it can impact rates as another impact of or role for the cost model.
Sure, thanks, Gina. So on this next slide here, this is an example of, I think we mentioned that New Mexico was a state we worked in last year, and the first state after DC to move to setting rates based on a cost model. And what you see on the left here is the increase between the prior rates, which were set by a market rate survey, and the rate set by a cost model in a family childcare home. So you can see that the infant rate went up 54%, the toddler rate went up 83%, the preschool rate went up 70%, and the school age basically stayed flat. So huge increases in the rate when you move from setting based on a market rate to setting on a cost model, mostly in the family childcare one, driven by the fact that we are now including a salary, an actual compensation for the family childcare provider. Now, you know, when the state kind of takes the results from the model, they make some decisions to set rates, right? So, you know, when in our model, essentially the infant, toddler, preschooler cost is really the same, because, you know, unless you're adding on additional assistant for the infants, you know, it's basically one classroom. But the state, in their process of setting rates, decided to still put an incentive on to serve different age children, right? So what you actually saw was that the infant rates and they still had different rates for infants, toddlers, and preschoolers. Now, you know, the increase was higher for toddlers because they were starting from a lower base. But what they did was, what you see in the table on the right is for centers, they didn't quite get to the full cost of quality, right? So they're actually underfunding by about 6% in centers. But for family childcare and group homes, that underfunding percent saying zero is a good thing, because that means they basically are paying the rate that came out of the cost model. So, you know, back before in 2020, you know, you would have been losing 38% on a family childcare home based on the old rates. You know, now you actually are getting covered at the cost of quality for those children who are in there. So, you know, huge increases seen in New Mexico by moving to this process for everybody, but for family childcare in particular. So, Gina, I guess I'll pass it to you to wrap up. We have lots of resources on our website. You know, we dropped some of them in the chat. You know, that cost modeling report is there. Our old webinars are on there. So, you know, a lot of this was quite quick, but, you know, we are very happy for you to reach out to us, you know, and we can talk more about any of these issues. Gina, you're on mute.
We are actively responding to a couple questions in the chat. So if you still have more questions, don't hesitate to stay on and, you know, hang out in the chat with us for a few more minutes, and we'll keep answering those questions. But we want to thank Build for this opportunity to partner to hold this conversation on this critically important topic. And we do hope that you will reach out at any time with more questions. We're happy to dig in deeper with everyone on this topic.
Thanks, everyone.
We'll leave up this slide for a second while we also take care of the couple questions that are still out there in the chat.